So moving to the next, we're basically trying to talk about, caring for the uterus, trying to diagnose what uterine diseases, okay, trying to also access for the health of the uterus, okay, if the uterus is able to take a baby or not. So one of these ways is the uterine balloon tamponade. So we'll talk about it, we'll talk about why it is done, and all of that. So this is just the balloon. On this side is a balloon kit, all right. On this other side is a uterus that the balloon has been put in and the balloon has been inflated. So why do we do this? Okay, why do we do all of this? So it's just it's a non-surgical technique, all right. It's not surgery. I'm not cutting you anything. So I'm doing this surgery because I want to control postpartum hemorrhage. That's a woman is bleeding a lot after giving birth to a baby. So I'm doing this surgery because I want to control that bleeding. So postpartum hemorrhage, if a woman loses a lot of blood after giving birth, she could possibly even die from it. You understand? So it works by applying pressure inside the uterus to stop bleeding when medications that have to make the uterus contract fail. So if medications are failing, you go in for this traditional method. So how does it work? The balloon device is inserted into the uterus via the cervix. Balloon is inflated with sterile fluid. It could be sterile water or saline. This will now create internal pressure that compress the bleeding vessels. So you want to compress the blood vessels so that you stop them from leaking out blood. So it will promote clotting if the blood vessels are compressed. All right. So the device is left in place for about 24 to 38 hours until the bleeding stops. Then you remove the device. Okay. So types of device: you have the Bakri balloon, have the condom catheter, all right, a Lavi balloon, all right. Just not really needed for this context. Just know that something like this exists. Okay. So benefits: it controls bleeding, avoids surgeries that might come if you allow the woman to bleed for too long, preserve fertility, can be used even in low resource settings. Anybody could afford that balloon, but not everybody could afford those surgeries. So when not to use: if there's a uterine rupture, you don't use this, all right. If the woman has an active infection, you don't use it, okay. You tackle the infection first, all right. Then if the bleeding is still not controlled, even when you do this, because this is kind of like the last option that always works, do you understand? So this is just it for uterine balloon tamponade.